you to stand here and then face that wall. Spinal stenosis is this condition where the nerves in the back of the spine that go down the spinal canal can get pinched. And that can lead to various symptoms, and it can happen anywhere in the spine. Most commonly, it occurs in the lumbar spine, which is the bottom part of the spine. We call that lumbar spinal stenosis. If it occurs in the neck, it can cause cervical stenosis, and that has a little bit different symptoms compared to the lower back, but it can be very disabling when people experience that. Symptoms typically are neurogenic claudication, which is a fancy term for cramping in your legs with pain, especially after you walk a certain distance. So a lot of people will notice over time they just can't walk as far. They get pain in their buttocks, they get pain in the back of their thighs, and it gets worse the longer they walk. Sometimes there can be some pain that radiates down their leg in sort of a sciatica type pattern, and there could be back pain associated with it too. And push. Good. Typically in the neck, it's going to cause something called myelopathy, which is a slightly different condition where the spinal cord starts to dysfunction, and people can notice they have clumsiness in their hands, they have clumsiness with their walking, and they eventually can lose control of their bladder. And so there's a lot of things that can happen if we don't address this over time. Core strengthening exercises and maintaining a very strong core, and also stretching, especially your hamstring muscles, can take pressure off the spine and the discs and prevent some of the degenerative changes to occur over time that causes stenosis. No pain when I press out here?
Not at all.
Okay, good. Well, first we have to do a very thorough history and physical examination. If I have a high suspicion of it based on their description of their symptoms, I'll get an MRI, x-rays, we'll review the results. A lot of people may have abnormal findings on the MRI, but it may not necessarily be the cause of their pain. Fortunately, most of what we do is successful with physical therapy and medications alone. Over 90% of patients get relief from that. If that doesn't do it, there's always injections where we place steroids right where there's a concern, or we can do a small surgery if they didn't get relief from that as well. And that typically just involves a decompression where we take pressure off the nerve roots. But if that doesn't do the trick, there may be need for a fusion if they have instability of the spine, or if they have a deformity that's also contributing to the stenosis. People come here, we find out what's the problem, we treat it, and if there's something else that comes up down the road, they can keep coming back. The PT's right downstairs. We have the MRI downstairs, so we even do the MRIs here. We have a surgery center downstairs, so we can do most of the surgeries here as well. So it's all kind of a one-stop shop. Well, if you get symptomatic relief from the stenosis from PT alone, there should be no significant impact on your quality of life long term. Most people get significant relief from surgery if they need it, provided that we get the spot decompressed that needs it, which is why we take into account so much of what the patient tells us and also what the MRI shows.
All right, to get more information about Illinois Bone and Joint Institute, call the number on your screen or head to their website, IBJI.com.